everyone coming. Our title was What to Expect and Who Does What in Hospital, which is quite a broad title. And we were thinking everyone has different expectations, especially when you heard what the psychologist said this morning. We all have different frameworks and we all have different expectations. And it depends as well, have you been to hospital before or is it your first time? Anyone, I'm sure everyone has been to hospital with their children at one point. Is that true? Yes. So you had already expectations and they might have been fulfilled or they might have not. And I guess sometimes it's quite difficult what will happen when you're coming in. Usually what happens when you first get diagnosed as a patient, you are in a local hospital or at a GP and they say you have to go to a specialist centre. And that's usually quite far away from home and can be quite daunting. And it's a big liver unit, perhaps. There are a lot of other children with liver disease. You meet other families who have also other conditions and you hear very frightening things. So it can be a very frightening experience. And then you meet all of us and we had all our work life there for a while perhaps. So we are all used to the conditions and we are all used to see patients and it can come across sometimes quite daunting and everyone seems to be so quick in what they say and they use language which you don't always understand. So it can be very scary and it's a lot of times also far away from home. I don't know if that works. Is that the one, Harry? So Bethany is a staff nurse. She has been at King's for 5 years. And as Lindsay said, I'm the matron. I have been there for 8 years, but a matron only since this year, beginning of this year.
To point it at the thing. Oh, no, don't worry, I can do it here. It's not difficult. Maybe on. That's fine, thank you. We said we are talking about admission to Rays of Sunshine ward at King's College Hospital, but I'm sure it's very similar when you go to Leeds or to Birmingham. We are all kind of doing the same things, and I'm sure Lindsay will step in and tell you if it is different, or please feel free to step in if you want to ask something, because you had different experiences somewhere else. You might meet different or lots of people, nursing team, medical staff and non-medical staff. And I'm sure it's sometimes difficult because they are all rushing. Some of them come in, they might not always even introduce them, but it's not because they don't want to, they sometimes forget. And we always try to remind ourselves it is very difficult, especially when you've just come to a new centre. Our nursing team on Rays of Sunshine ward, we are 18-bedded ward, and we have everything from every liver condition. We do liver transplantation, and we also do small bowel transplantation, and some of them have multi-organ transplantation. We have all varieties of liver conditions and also gastroenterology on our ward. Myself, I'm based on the ward and the ward manager as well. In every shift you have a nurse in charge, and we usually have an allocated nurse, and they should always introduce themselves and be there for you for the day. And it would be great, and we always try to remind them, introduce yourselves and plan the day with the family if you can. Sometimes, because we're all human, and it doesn't always go to plan, it can go wrong, or it might be they say ultrasound is at 11 and then they do it at 9 or at 2 o'clock in the afternoon, but that's not, we like it organized, but it doesn't always happen like that because something else might have come in between or some emergency, or just to know it's not always going to plan as we wish. We have loads of nurse specialists. We have a team of 5 nurse specialists, 1 small bowel nurse specialist. We have 3 transplant coordinator, and we have a pain nurse. So you can see already, only from our nursing team, we have quite a few nurses on every shift. And a new role we've introduced is about a year ago now is the procedure nurse. Because a lot of procedures are happening, we wanted to make sure there's one nurse who is concentrating and helping the patients and families through the procedures. And Bethany will talk a little bit more about that role. Our medical team, we have ward-based doctors. Some of them are quite junior and they rotate every 6 months, so for them it's sometimes also a new field to come into, but they are very well supported by a registrar usually, who is a bit more a senior doctor, and then you have always a consultant, and our consultants are there most of the day. They do the ward round, they speak to parents together with registrars or SHOs usually, which are the junior doctors called. We have surgeons, we have general surgeons, transplant surgeons, so you see a lot of people coming in and out, and the radiologists are usually in their department, but sometimes they come also to us on the ward if we have procedures there. There's a huge variety of a non-medical team, and they are all there as well to support you and the family throughout the journey. We have a play specialist, we also have a youth worker, which is not on there. There's a picture of Irene, our family liaison worker. She is usually there to support the families, just come around for a chat. She does coffee mornings. She helps them when they have trouble with traveling or accommodation. We have a run at McDonald House, which has 24 beds. Which she always helps you as well, or that the family can come at a weekend, or sometimes parents say, I'd like to bring a grandmother or auntie or someone with them, just that you have someone, because especially when you're far from home, it's nice to have someone. We are very careful with siblings. We try to find a balance between having siblings on the ward, but equally to be aware it's not a good place for siblings to be. You know, equally they get really bored on the ward, and we are always cautious of infections. It could cause the siblings to get infections, but also for the ones who are in hospital, so we try to find a balance. The play specialist and the youth worker are usually around the whole day. They have a room off the ward, so they can entertain children. They also help with procedures, and when they are very worried about cannulas or so, just to distract them and help them. We have a social worker, and then everyone thinks straight away, I don't have a problem, I'm okay. But the social worker in our unit just helps with things like a letter for work, if you have problems with the employer, or if you need a housing letter, sometimes you need to be rehoused in a bigger accommodation, or it could be, yeah, you just have problems with someone locally, and she's just there to help you, or financially to see what kind of benefits you could get or support. You met our two psychologists this morning, Anna and Louise. They come regularly to the ward, but also they take families or children off the ward and have conversations there, or they meet them in outpatients. Dietitians, as you heard this morning, they're really important, especially because children with liver disease can be quite malnourished, and we try, and sometimes again to find a balance. They want to get a lot of calories into the children, but equally you feel sometimes the pressure of getting too much of those in, isn't it? But they are always at the ward round. You have the physiotherapist, especially for children who have been there for a long time or have been very poorly, just to make them physically stronger again and get them up on their feet quicker. We have occupational therapists, and the pharmacist is quite a vital part of our ward round as well. They make sure that all the drugs we are giving is right and that they don't interact with each other, but also to check with you what medicines is your child on, or what do we need to start, and what are the side effects and how do they work.
Okay, so the next one's just about what investigations could you expect on your admission. Obviously, different admissions, different things might go on, but this kind of explains routinely what will happen. So when you first come in, you'll have a nursing and medical assessment. So those will be going through things like just taking the height, the weight, checking our personal details with your notes, and then the medical team will come and just do a quick examination and also go through past medical history. It's not that they haven't read your notes before and know all about it, it just gives them a chance to catch anything they might have missed and just hear it from you and your child. We also do routine swabs on every patient that comes in. That's just so we can check infectious statuses. We do a set of observations, so they're just for us to have an idea to see if there's any variations for the norm for their age. So this will be the temperature, respiratory rate, heart rate, blood pressures, and oxygen saturations. You'll also have blood tests when you first come in. This just gives us, again, it's for the doctors, and it's just a different investigation for them to look at. You might find that cannulas are inserted. That's obviously a way that they can give antibiotics and for procedures. And often on the ward, ultrasounds will be performed. Again, it's just a non-invasive procedure. Of course, there's lots more, but that's just the routine ones. Oh. Here we've just made a very ideal timetable of a day on the ward. Of course, in the morning you can see it says the doctors sit down ward round, where a lot of plans for the day will be made, so things could change. We have a school in the hospital that opens 9 to 5 for the children that can attend. I put on there the different times, obviously, that the food comes round. Nursing observations, again, are performed at a 4-hourly basis. Again, that depends on the child's condition, and that can vary. Also different medication times, and then the nurses hand over for the night at 8 o'clock. And again, this is just an ideal night on Rays. I'm sure when you've been in hospital and stayed overnight, you know that it doesn't always work out like that, but of course that's an ideal shift. You'll also see that blood tests are taken at 6 in the morning. This can sometimes cause a bit of upset, but that's just so if any of the children are on immunosuppression, we get the levels back before the morning dose at 8 in the morning, and also it gives the doctors a good indication of what procedures can happen that day because they have the blood tests back before them. And then the future plans. So although the procedure nurse role has been around for a year, it was rotated on a 2-weekly basis, and I've just stepped into it on a 2-month trial as full-time. So the plans I have is basically to focus on a smoother admission process. So I know you will get your letters to say what you're coming in for, but I know often that doesn't give you a chance to answer any questions you may have. So what I plan to do is to give you a call, whether it be a few days before or a week before, and just go through that you're happy with what you're coming in for you to ask any questions so that we could go through the procedure. And that way, hopefully, it will leave a bit of anxiety you might have before you come in. We also always give, as I'm sure you filled out, discharge, how are we doing surveys. It might seem like a survey that isn't looked at, but we do look at it quite regularly. And things that parents say do get listened to. So recently, we've been told that the parents' room kitchen on fridge on Rays isn't big enough, so we've just ordered a new one. So if ever you are in, do fill out that survey because it does get listened to.
Do you have any questions? That was a very brief overall view. We wanted just to let you know that's how we do things and that's what the basics are. But I think it already starts, as I said, before you come for admission. Sometimes it seems a bit funny. You get a letter to come in on the day, but to call beforehand for a bit. And then you call and they might say, oh, you have to wait for the ward round because it could be we planned discharges and they don't go ahead as we thought. So the plans we had for the bed allocation might not always happen as we thought it would. And the way you have to plan investigations early on, that always doesn't give us the time then, because you don't know what will happen on the day. So it seems sometimes a bit unorganized and you have to wait for the bed. We try and work on the discharges to make them a bit more smooth. But again, that depends on how quick they can make a decision, because they might have made a decision for you to go home, but then something has changed again in the condition, and it is because we are not robots. you know, we are all humans, and it can change in your child's condition. And there's so many people coming around, and it seems sometimes a bit, everyone has their own opinion from their area, isn't it? And then it's sometimes hard because they all pull in their direction because they are focused. And we have weekly meetings which are quite helpful for us, which we call multidisciplinary meetings, where we discuss and we come to a conclusion, and then they come around for the ward round, and that obviously helps. The nurse specialists come around every day on the ward to talk to you, and you can always call. And sometimes it is a bit difficult. We sometimes get the feedback, we said, you would call us and then you never called. Please don't wait too long, because it might have come something in between. We planned already to call you and we forgot. And that's not because, you know, on a very bad thought. It's just, it happened. And please don't wait too long at home and wonder what happened. Just call again and say, listen, I had expected a phone call and I didn't get one. What is the next step on the journey? Because that can be quite difficult sometimes. That's our ward. That was the Big Yellow Friday this year. We tried to be very yellow on that day. Do you have any questions for us from the nursing point of view or from the ward? Or do you have more questions about the investigations?